Okay. Trying to get to 15. Okay. Still don't see the. Now let me hold on. Let me try this full screen. Don't see everybody yet. Hey, Trent?
Yeah.
We still trying to get everybody on? I see Miss Moore, but that's the only person.
You won't see them. You can see that the participants are increasing. We've got 28 participants, but you won't see them.
Yeah, I just sent you a message in the chat. You're only going to see the panelists. Everyone else is will just be viewing.
Oh, okay, okay.
So I'm gonna stop sharing and we can.
So we ready to get started then?
Yes, sir.
Okay. Okay. My name is Hank Dozier. Everybody knows that. I just wanted to thank you all for being participants in this first town hall meeting for the year 2022. We thought it would be good for us to be transparent in some of the things that we're doing, some of the accomplishments that we made, and from a logistics standpoint, and also with the COVID-19, we wanted to invite a clinical person to kind of broaden our horizon of what's going on. So I ask you to be with us in prayer. We'll ask our pastor, most of all, let me give you some tips here. When we start, we'll ask that everybody, if you have questions, please try to present them through the chat. And of course, if there's something that's complicated, we'll deal with that accordingly. But our preference would be that you would put it through the chat so we can all engage in those discussions, if that's okay with everyone. So that being said, I will ask the pastor to lead us in prayer, because I think the prayer is the centerfold of everything that we do and everything that we say. So with that being said, I'll ask the pastor to lead us on.
Amen. Thank you, Brother Chair. And thank you for all of our panelists, and particularly our guest, Dr. Jacobs, this evening, and all of the St. Mark's family. And we are here. God has brought us to this moment. We're grateful for this privilege to be before our God again. So let us ask God's blessing upon our time together. God, we're so grateful for who you are and who you've allowed us to be in you. We thank you that you have kept us and you have blessed us. You have watched over us throughout this entire pandemic season. We thank you for keeping us safe and giving us wisdom as a congregation, that we intentionally do no harm and we intentionally love our neighbors as we love ourselves. We thank you for your continued work through St. Mark's. We thank you for the grace that we've had with one another, and as we navigate through something that's new to all of us. So we thank you for encouraging us and inspiring us to be graceful with one another. We thank you that you've kept us all, and that in St. Mark's, as far as I know, that no one has succumbed to COVID-19. We thank you for those who've lost loved ones through the pandemic, and we thank you that you continue to give us wisdom and discernment as we move forward together as a congregation. Thank you for this time tonight. Thank you for guiding us and allowing us to hear from you and hear from one another as we press forward together. In Jesus' name we pray. Amen.
Man, thank you for that prayer, Pastor. And I believe this is my cue to introduce our guest clinician, physician, community advocate. This is a gentleman that I really do admire. He is one of our leaders at Atrium Health, not for his credentials, which he's very credentialed as a physician, but because of the action that he takes and because of his willingness to contribute to conversations like this. I will tell you that Dr. David Jacobs is a trauma surgeon and also our vice chair for diversity, equity, and inclusion for the Department of Surgery. I'm sure he would want you to know that about him, but I want you to know that he is a community advocate. So based on the things that he's seen happen in our emergency room, like gun violence, like the effects of this pandemic, not only does he contribute to the healing process from his clinical expertise, but he organizes and rallies in the community around gun violence, around COVID-19 education, like what you're seeing him do today. And because of that, he's been recognized as an MLK medallion recipient in the community. He's received numerous accolades, numerous awards. And so I'm glad that we have the best with us today to answer some questions and to present to us where we are with this pandemic. So as Brother Dozier reminded us, if you have questions, please put them in the chat. We'll do our best to get to those questions. But Dr. Jacobs has a presentation that he's going to walk us through. So if we could all just remain on mute and listen to his presentation, we'll certainly be watching the chat for questions. So it is my pleasure to present to you a very, very strong leader and a person that I respect, Dr. David Jacobs. Dr. Jacobs, I turn it over to you.
Well, thank you, Fernando, for that very gracious introduction. I can only let you down from here with that kind of introduction, but we'll try to do the best we can to try to shine some light on this particular issue, which is changing in front of us on a daily basis. And so Fernando has given me about a half an hour to speak with you about this. I'm going to try to get through this a little bit more quickly so that we can get to your questions. But this is just going to provide a sort of a high-level overview of what's going on today with the COVID-19 pandemic. And I emphasize the word today because this is a ever-changing enemy for us. And as soon as we feel like we have gotten the upper hand, something else happens. And so the information I'm giving you is based upon the best information that we have today, but even as soon as next week, new information may come down the line that would require that we change some of what we're telling you today. So I'll go through this fairly quickly and just give you, and I know that you already know a fair amount about this this pandemic. I'm trying to get things out of my way so that I can see well here. There we go. Okay. So when we think about what COVID-19 is, it's a family of viruses. It's the coronavirus is the official name. It's been around for decades. And I think that's important because a lot of the vaccine hesitancy and skepticism is related to the fact that we were able to come up with a vaccine so quickly. But that's again because it belongs to a family of viruses that has been around for decades, and we know a fair amount about it, even though, as I mentioned, this one continues to throw us curveballs. So it's one of the reasons why we had a good head start in terms of coming up with vaccines. We believe it spreads mostly from person to person through droplets in the air when you come in close contact with a person who's coughing or sneezing or even talking, which is why wearing the mask is so important to protect not only you, but those around you. We know it affects different people in different ways, and we'll talk about some of this as we go forward, but certainly when it first came out, it affected primarily those who were elderly and those who had associated medical problems. It had a disparate impact upon minority communities, communities of color, because of the types of jobs that we predominantly work in, public service jobs, indispensable jobs. And whereas some folks had the luxury or the privilege, I would say, of being able to work from home, many of the folks that live in our communities did not. And so they were constantly exposed to this virus. And we all know that there's also disparate access to healthcare, disparate access to testing, disparate access to treatment. And so this particular disease has wreaked havoc on our communities of color. So I think that's a good way to start. And you know that there's been a significant impact across the community. Schools are closed, hospitals are overflowing. One of the things that I think people don't recognize is the fact that that even if you don't have COVID or you don't know someone who has COVID, this disease is likely to impact all of us. Many of our hospital beds now are full of patients who have COVID, and that restricts access. So when those gunshot wound patients come in, or a heart attack or stroke, there may not be places to put those patients. Patients are frequently waiting hours and sometimes days for a hospital bed because the hospitals are full. And that's just not here in Charlotte, that's across the country. So even though you can keep yourself healthy from COVID, we are all still impacted by this disease. We can't get childcare. Restaurants are closed. People have lost their jobs. So it's had a wide impact in our community beyond just the disease itself. Well, what can we do? Some things haven't changed since March of 2020, and those are the 3 W's: wear, wait, and watch. So wear your mask all the time, and that hasn't changed even with the availability of vaccines. Social distancing is still important, I think, because you don't know who has this virus. We'll talk about the new virus or the new variant of the virus and how easily it is transmitted from one person to the next. But in the early stages of this disease, there are no symptoms, and you can communicate this disease to somebody else without even knowing it before you get symptoms. And so it's always safe, if you're not able to wear a mask, to public distance, stay 6 feet apart, and then obviously wash your hands, particularly if you come in contact. I can't tell you the last time I actually shook hands with somebody. We're rubbing elbows now and trying not to come in direct contact with people. But if you're shaking hands with people, you're coming in contact with surfaces. Don't put your hands on your face. Don't put your hands in your mouth before you get an opportunity to wash your hands. So those things haven't changed. Well, what has changed? The variants have changed. And so we started this in March of 2020 with what was called the Alpha variant, the first letter in the Greek alphabet of Alpha. And we thought that was going to be it. We thought we would finally get through Alpha. We would maybe achieve this concept called herd immunity, and we would move on. Well, since then, there have been multiple variants that have come and gone, some serious, some not serious. But you've heard the term Delta, and now everyone's familiar with the term Omicron, which is yet another variant of this virus. And every variant that comes along is a little bit different and challenges us in a different way to respond. So we'll go over some of the different kinds of variants, but that is important. And I'll come back again to that in just 1 second. So what kind of variants are there? There are variants of interest. We study them, they have scientific interest, but they really probably are not going to be important in terms of creating disease and illness on a large scale. There are variants of high consequence, where we know that the vaccines that we have don't offer protection. Right now, we don't have any COVID variants that are of high consequence, and we hope and pray that we don't ever see those. We do, however, have variants of concern, or which we abbreviate as VOC. And these are variants that come up on our radar screens. We hear about them. Alpha was the first one. There was a beta that came up in England shortly after Alpha came out. And everybody was concerned that that was going to become a dominant variant or a dominant strain. That didn't pan out. We thought we were doing well, and then Delta came along. So you can see here Alpha, Beta, Gamma, Delta, and Omicron are the ones that have had clinical significance that you probably have heard about, but I will warn you that Omicron will probably not be the last variant that you hear about. So where were we back in 2000, last year, back in 2021 in September? We made it through Alpha and Beta, and we thought we were on the downswing, and then we began hearing about Delta. Well, Delta was special because Delta was more transmissible and it caused more severe disease. So patients were not only getting sick, patients were not only having positive tests, but they were being admitted to the hospital and being put on ventilators, going to the ICU, and dying in numbers greater than we had seen with the Alpha or the Beta variant. This is around the time that the vaccines were beginning to work. Vaccines first became available in December of 2020. And so we felt like in the early part of 2020, well, now we're vaccinated, now we're good. But Delta showed us that vaccinations were not entirely protective, but that they were very, very, very effective against severe disease. We'll talk about that as we go along too, because there's a common misconception that the vaccines prevent infection. That's not what they were designed to do. They were designed to prevent hospitalization, severe illness, and death. And they're very, very, very effective in those regards, but they were really not designed to prevent infection. And I think that's an important thing to keep in mind. So vaccination continues to be the best way to protect our communities, but we still need to wear those masks, vaccinated or not. So that's where we were in September. Delta was sort of surging, but if you look at this graph, it sort of shows you where we were. You can see towards the end of that, Delta was beginning to increase, but if you look at the far right-hand corner where that red circle is, I don't know whether you can see my arrow, you can see this beginning of the downturn maybe towards the end of September, August, September. We thought maybe Delta was beginning to recede. And again, we're going to take a deep breath. Maybe we have this thing beat. That was in December. I mean, that was in September. Well, on November 24th, we first began to hear the words Omicron. And we said, well, here we go again. The problem with Omicron is that it's much, much, much more contagious. Some people estimate between 100 and 1,000 times more contagious than Delta was. So if you look at this graph on the right, you can look and you can see the first couple of peaks, Alpha, Beta. You can see Delta there in September of 2021. And now we're in January and we're dealing with Omicron. The original information that we had on Omicron was that maybe it caused less severe disease, but there's always a lag between infections, number of infections, and number of deaths. It takes a while for this disease to make you sick enough to kill you. And so we see infections rise first, then a couple of weeks later, we'll see hospitalizations rise, and then we'll see deaths rise. And so the fact that we haven't seen an increased number of deaths doesn't necessarily mean that Omicron is less dangerous. It means that maybe we haven't seen the worst of what Omicron has to offer yet. So we haven't seen a lot of ICU ventilator numbers increase, but there's those important three letters yet. We're still waiting for the other shoe to drop. So what do we now know about Omicron? It's the newest variant. It's much more contagious, and it predominantly impacts folks who have not been vaccinated. So we'll show you a slide a little bit later that speaks to the patients that we're seeing at Atrium that are on breathing machines that are in our ICU, but the vast majority of those patients are unvaccinated. So we do know that the vaccines work. I will say that as we get more and more and more and more variants, the vaccines will stop working. These viruses are very, very, very smart, and they will eventually evade the current impact of our vaccines. That's why we had to get boosted when we initially didn't think we had to, because the virus has gotten smart, and we need to try to stay 1, 2, 3, 4, 5 steps ahead of these viruses if we're going to try to keep ourselves safe. Omicron is currently the dominant strain in the US. And again, I would add the term today, because we don't know what's coming down the line. So here's the surge. It became the dominant variant in less than 1 month. It just goes to show you how quickly Omicron has sort of taken over. Delta is no longer the predominant variant. Delta probably still kills more people now because we haven't been exposed to Omicron long enough. But Omicron, if you test 1,000 people that are COVID positive, 95% of those folks today are going to be Omicron, and so that is the variant of concern right now. The doubling time is less than with Delta, which means it spreads faster and it grows faster. So it spreads faster within the community. It also begins to have symptoms sooner. So if you get exposed to Delta, it takes 3 to 5 days for you to begin to have symptoms. With Omicron, it's 3 days. And so folks are getting sicker sooner. And the risk of reinfection, as you can see there, is much higher than it is with Delta. Again, we don't know whether it's going to be as severe. We're hoping it will not be. We're not seeing a lot of loss of taste and smell like we saw with Delta. So as I said, information is changing on these every single day. And what I'm telling you is what we know of today. So I mentioned earlier, this is what's going on at Atrium. 92% of those on life support at Atrium are unvaccinated. And to be honest, that's caused those of us in the healthcare field to really almost have a sense of frustration and burnout that we're expending so many medical resources when some of this could have been avoided with folks just getting vaccinated. I will also take this time to say that one of the reasons that we had a beta, one of the reasons that we had a Delta, one of the reasons that we now have an Omicron is because we didn't get folks vaccinated soon enough. If you get folks vaccinated soon and you extinguish the virus can't mutate, it can't change. But the longer there is virus around, the more likely it is it's going to change, it's going to mutate, it's going to try to outsmart us. And so then we have the Omicrons and who knows, the Thetas and the Zetas and whatever else might be coming down the line. So it's so very important to get everyone vaccinated as early as we possibly can, as soon as we possibly can, because that's the only way we're going to actually extinguish the virus for good. So how do we stay safe? We get vaccinated, we get boosted. That really will protect you, but it also decreases the chances that Omicron, that COVID is going to change, it's going to mutate, and we'll be dealing with another variant of concern within the next month or so. That's something that I'm not sure everybody recognizes. I talk to people and they say, well, I don't need to get vaccinated. I'm young, I'm healthy, I'll be fine. Well, it's not just about you. It's about the community. It's about getting rid of this virus. And the only way to do that is to get as many folks vaccinated as we can to try to keep that virus from staying one step ahead of us. So that's Omicron. That's the big part of this presentation. I've got several more slides, but we can go through this more quickly. This is stuff that I think you already know. What vaccines are out there? We've got the Pfizer, we've got the Moderna, we've got the Johnson & Johnson. Pfizer is the only one that's been FDA approved. The Moderna and the Johnson & Johnson have emergency use authorization. So they can be given. They've been proven to be effective, but the Pfizer is the only one at this point that actually has full FDA approval. So you'll hear people ask about that. Pfizer is also the only one that has been recommended that has been approved for folks for kids 5 years and older. The Moderna and the Johnson & Johnson still only for patients 18 years of age. You can see The Pfizer and the Moderna need 2 shots plus a booster. The Johnson & Johnson needs only 1 dose and a booster dose as well. And so if you've been vaccinated, we want you to get boosted. And you can see that even once you're vaccinated, still 2 weeks before you're protected. And so the earlier you get vaccinated, the earlier you get protected. Some folks say, well, I'm going to run out and get vaccinated today because I'm going to the Super Bowl party in next week. Well, if you're going to a party next week and you're getting vaccinated, you're getting your first vaccination today, you are not going to be protected at that Super Bowl party. So early and often, sort of like voting in Chicago, as they say. That slide kind of got chopped off there, but we'll get into this in just a second, talking about the safety of these vaccines, but they've all been rigorously tested for safety and effectiveness. Are they entirely safe? In other words, are there no side effects? The answer to that question is no. No vaccine is 1000% safe. There's always going to be some side effect, but these are minor and by and large, non-life threatening, and certainly much safer than allowing yourself to come down with COVID-19 infection. So we mentioned that the Pfizer does have FDA approval. You can see all the hoops that Pfizer had to jump through in order to do that. And so it's a very, very rigorous process, or else the Moderna and the Johnson & Johnson would be approved by now. So I think folks can take some comfort in the fact that it is a rigorous process. Folks have criticized the FDA for taking too long, but I think you would want the FDA to exert all caution and all care before they issue their full approval. So this slide talks about both the Pfizer and the Moderna, and I just want to call your attention to that third bullet. The side effects are extremely uncommon. You can see the number of cases that have been reported out of 318 million doses, so much, much less than 1%, and no deaths have been associated with vaccines. So that's the bottom line in terms of safety. That's the bottom line in terms of how effective these vaccines are. A couple of other questions about vaccines that folks may ask you, just so you know. There's no charge. You should never be charged for the vaccine. We talked about the fact that you need 2 weeks after your second dose to be effective. And now you really need to be boosted if you want to be protected against Omicron. We know that the booster will add that degree of protection. And so again, the earlier you can get vaccinated, the better. If you've already had COVID-19, the question is, do I still need to get vaccinated? Absolutely, yes. Everybody responds to COVID-19 infection differently in terms of how many and how active your antibodies are. And you'll only get boosted if you've had COVID and you go ahead and get your vaccines. You'll have that much more immunity. So the answer to that question is yes. After I get my vaccine, can I stop wearing my mask? The answer is no. Again, because everybody's different. The vaccines protect against serious infection, hospitalization, and death, but don't prevent against infection, period. So you can still pass it on. And if you've got elderly folks in your house or folks who are not vaccinated because they're kids and they can't get access, or because for whatever reason they haven't been vaccinated yet, you can certainly pass the disease on to them. This is a question I hear all the time. The vaccine's all that effective. How come I'm hearing about all these athletes who are coming up positive for COVID now? And this gets to that point I made earlier, that the purpose of the vaccine was never to prevent infection. So all those athletes that you hear about that are on protocol and sitting out for 5 or 6 days, it's because the NFL, the NBA up until now has mandated testing. And many of those patients that are positive don't have symptoms because they're vaccinated. And if they have disease, it's very, very, very mild. We're looking for the disease now. We're screening for the disease now. And so we don't expect that we're going to necessarily see fewer infections, but we are seeing fewer deaths. We are seeing fewer hospitalizations. You can see 25-fold reduction in hospitalization, 25-fold reduction in death with vaccination. So they're effective for what they were designed to do, but they were not designed to prevent infection overall. And that's why we see so many positive tests out there. Those are in predominantly patients who are not having symptoms. Will your privacy and personal information always be protected? There's a lot of folks who are undocumented here, who are worried that if they come forward and get vaccinated, that ICE will come and get them or something of that nature. That is not the case. Your personal information is kept personal at all of these sites and is not submitted to ICE or anywhere else. So that should not be a reason not to get vaccinated. Talk quickly about vaccine hesitancy and why folks would hesitate to get vaccinated. I don't need to tell this audience that certainly the African American community has ample reason to not necessarily have a great deal of trust in the healthcare system. There is a legacy starting back with the Tuskegee study and even before, dating back to times in slavery where slaves were subjected to experimentation. And we know that there are disparities now that are related to implicit bias and racism. And so you always have to have your guard up. You always have to be an educated patient, an informed patient, an engaged patient, ask questions. But in this particular case, I think there's some reason for comfort. We do have somebody from the state of North Carolina who has been intimately involved in the development of these vaccines, Kismekia Corbett, from a place I've never heard of in North Carolina. Perhaps some of you have, but she is one of the lead investigators in terms of vaccine research in this country. And so I think we can take some comfort, some solace in the fact that she is one of our own. She's from North Carolina, but she's one of our own, and that she's looking out for us. A lot of folks believe that maybe some of the tests that were done, or some of the testing of the vaccines that were done, well, they didn't test Black folks. So how do I know that this is going to work in Black folks? We'll get to that in just a second. So here's one myth: the vaccines were not tested enough. And as you can see here, the COVID-19 vaccine was based upon many years of work. I started out by telling you that this is part of the coronavirus family, which we've known about for 40 or 50 years. So it's just a matter of tweaking our vaccines a little bit so that they were effective against this particular COVID-19 strain. But we had the car essentially built. We just had to add a few accessories onto the car in order to come up with this particular version. This slide looks at the number of folks of color who were engaged in the clinical trials. And you can see for the Johnson & Johnson, probably 13% of the patients that were in the trial were Black. For the Pfizer, 10%. For the Moderna, 10%. So almost roughly the proportion that we represent in the population were in these clinical trials. And so we can't say that it wasn't tested on people of color. Therefore, that should be a reason that I shouldn't get this vaccine. Significant numbers of research subjects of color were involved in these studies. Myth number two: the vaccine has side effects. Well, every vaccine will have some. You'll have some pain at the injection site. When I had mine, I was fatigued for about 24 hours, kind of tired. I had a little bit of a headache. I didn't have chills. I didn't have fever. Didn't have nausea. But that's telling you that your immune system is working. That's how you know that your body is building up immunity when you have those kind of symptoms. But they're not serious and they don't last long. And so I don't think, again, that that's a reason not to get vaccinated. Some folks think you can get vaccinated you can get COVID-19 from the vaccine. That can't happen because there's no virus in the vaccine. Vaccine is made up of all sort of manufactured parts. There's no active live virus in there. And so that's another myth. Some folks believe or have heard or read that the vaccine causes infertility. Again, they've looked at sperm counts. They've looked at female fertility. It's been unassociated with any side effects of the vaccine. So we're not coming up with any substantive reason to not get vaccinated from a medical perspective. And then the final one is that it'll hurt your baby if you're breastfeeding. Quite the contrary, if your immunity passes through breast milk, you may actually protect your newborn as opposed to making your newborn sick. So there may be some advantages, particularly because newborns are not approved to get vaccinated yet. And the same thing with pregnancy. We talked a little bit about this earlier with fertility. There's no reason to believe that the vaccines, there's no data to suggest that the vaccines will compromise pregnancy or fertility. Some folks believe that there are harmful ingredients. They put GPS chips and all kinds of things in there. Again, there's no live virus. There's nothing in there. I think you're going to have to take our word for it. There's no proof. It's hard to prove that there's not something in there as opposed to proving that there's something in there. But there are no GPS chips and those kind of things that have been added to the vaccine. People are going to believe what they're going to believe. But we can tell you that there are no additives, just a vaccine. Some folks believe that, again, that they don't need to be vaccinated if they've already had COVID-19. We discussed this. That's not true. And again, with every variant that comes out, you may not be protected against the new variants. And so get your vaccine, get boosted, because this is going to be a long battle. How long should you wait to be vaccinated? If you've had COVID-19, as soon as your symptoms are gone, you should go ahead and get vaccinated. Pretty straightforward. A lot of people in our community are strong support of this, particularly folks in our faith community. You may know Reverend Smith from Palmer Grove Baptist Church. He says here he didn't have any real side effects. He's an ardent supporter of this. Father Gregory from Our Lady of Guadalupe, same thing, excited about getting the vaccine. You can see him getting his shot here. And then Jerry Cannon from C.N. Jenkins Memorial Presbyterian. Again, they were actually giving vaccines in the church. They used their church as a vaccination site. So clearly a lot of support within the community to go ahead and get this done. Again, our community has been disproportionately impacted by this disease. And so our community should be, in my view, should be first in line to get vaccinated, be the most enthusiastic about getting vaccinated. Just a few words about vaccination trends and where we are, and then we'll be done. You can see we got about 210 million people that are fully vaccinated. You can see the age breakdown here, about 75%, about 75% of people are eligible for their boosters. We've got probably about 60, maybe 50, 60% of people who are fully vaccinated, fully boosted in this country. That's not enough, unfortunately. We really need to get everyone vaccinated, everyone boosted, if we're going to try to keep these variants from popping up. So where are we? Got a bunch of variants that are coming along, probably. Whether they will be of variants of concern or not, only time will tell. The only thing that we can do in the meantime is get vaccinated and continue to wear our masks, continue to social distance, continue to wash our hands. The vaccines were not designed to avoid infection altogether. They were designed to reduce your risk of illness, hospitalization, and death, and they are very, very, very effective at doing that. Everybody who's eligible, kids now down to the age of 5 with the Pfizer, should get vaccinated, should get boosted if you're age 18 or over. That's the best advice we can give you right now. Get your vaccination and then stick to the 3 W's. And that's really all I have at this point, and be happy to open it up to any questions that you all may have. Thank you. I'll stop sharing.
Great presentation, Dr. Jacobs. And I believe because you added in that Q&A section, there are no questions in the chat at this point. So your Q&As may have covered some of the questions from our members. So I don't have anything in the chat, Brother Dozier. So I have one here. Does having a humidifier help in the home? In your medical opinion, Dr. Jacobs, does having a humidifier help in the home?
Probably not. I don't think it hurts. Like anything else, they're good humidifiers, and they're humidifiers that probably don't do a whole lot. You know, a lot of folks are asking about air filters, and if I get a better air filter, and you'll see when you change the air filter for your furnace, you will see claims that this filters 99.9% of all viruses and so on and so forth. Those things don't hurt, but especially with Omicron, it is so infectious that it may, unless you have an ultra efficient furnace that's turning over the air, like you would see in a commercial airline where the air gets completely turned over in every couple of minutes, those things probably aren't going to make a difference in the standard home that we would live in. So I would not rush out and buy a humidifier.
Not a humidifier. Is there a difference between air filtration systems and humidifiers?
Absolutely, yeah.
Okay.
So a humidifier certainly doesn't usually come with a high quality air filter, and it will add humidity to the air so that your nasal passages and your breathing passages don't get dried out. But it's not intended to filter out viruses and bacteria and pollen and those kind of things out of the air. It's just meant to add humidification to the air. So again, probably won't hurt, but it's probably not going to substantially help either.
Okay. This last, I think we have time for one more question, Dr. Jacobs. And this one came from one of our members who says that she usually opens the windows when her family members come. And is that a good practice to open the windows when people come and when she has company?
Only if you're trying to escort your family members out of the window. I say that tongue in cheek because I've got a really, really good friend who is a lung doctor, and he posted on Facebook. He's got family in New York, and they come through Charlotte every year. And he said, "Don't come to my house if you are not vaccinated." These are his own kin. And so this issue of social distancing, I think, is important. Anything that you can do outside is going to be preferable. With the weather being cold, folks are not going to want to go outside. And that's when we tend to see increasing infection rates because everybody's inside, everybody is together. So yes, if you can tolerate the cold, open the windows, circulate the air. Better yet, move that event outside if you possibly can. But opening the windows would probably be a step in the right direction.
Very good. This is, I know I said there was one more, but let me slide this one in because I think it's important. What is the CDC saying about masks and temperature checks for businesses, child development centers, and restaurants? So I know you've reiterated the importance of the mask, and so I think you drove that point home. What about temperature checks?
The CDC has changed their viewpoint, and they've come under some fire for doing that. It's been suggested that they have buckled a little bit to public pressure because folks want to get back to work. They want to get the kids back in school, want to get the restaurants open. And so the CDC guidance, I think we have to follow it, but I think we have to be very, very careful. They have said what they've always said. Masks are important. What they're telling us now, I'm sorry. What they're telling us now is that the quality of the mask is important. And I should have mentioned that. The cloth masks, don't waste your time. Those gaiters that you see people wear that really don't snugly cover the nose and the mouth, don't waste your time with those. You need a surgical mask, preferably an N95, if you can get hold of it. I can tell you, and I'm sure Fernando can tell you as well, Atrium is getting ready to mount a campaign to distribute N95s. They're much, much, much more effective than a regular surgical mask and million times more effective than a cloth mask. So N95 is what you should try to get. If you can't get an N95, then wear two regular surgical masks. Stay away from the cloth mask. If all you have is a cloth mask, get your hands on a paper mask and wear a cloth mask on the bottom and a paper mask on the top. If you're in a public space where you can't social distance, you need to wear a mask. Go into a restaurant, take the mask off while you're eating, put the mask back on when you're not eating. So masks all the time. The schools, they're all over the place. Some schools are doing a good job with social distancing where it becomes less important. Some schools are not. Some classrooms are not. They're all over the place. The guidance has still been the same. Social distance, masking when you can't social distance. Those are the guidelines.
Yeah, that's strong, Dr. Jacobs, and a good point to end on. So, church family, this was Dr. Jacobs. We tried to deliver you the best. He's one of the best at Atrium Health, and we certainly appreciate his insight and counsel this evening. Dr. Jacobs, thank you very much for your time this evening. That was probably your call. I know I said 6:30. Somebody's probably calling you to duty now. So we're going to let you get back to work, and we appreciate you, sir, everything that you're doing. And let me just take this moment to thank our pastor, our AB board, our worship team, and our trustees, our leadership team, our lay leader for having the thought leadership to have this discussion today. Thank you for thinking of your members and the safety of your members and your congregation. So thank you so much. And we'll turn it over to Pastor and Dr. Little.
Thank you and good night. Thank you.
Good night. Thank you, Dr. Jacobs.
Thank you.
Wonderful presentation. So we're grateful to have heard, and I see that there are a couple of questions that came in after we made our commitment to end with Dr. Jacobs. So we'll capture those and see if we can get those answered. Thank you.
I saw that, Pastor, the KN95 question, and then whatever other question we'll certainly take. And I'll ask Dr. Jacobs to answer them personally and get it back out to the group some kind of way. So we can certainly do that.
Great. Thank you. Thank you. All right. So again, we thank you for joining tonight, and we wanted to gather as a church family to allow you to hear the heart of your leadership team and to touch base and to connect on where we are and where we intend and hope to go. We've heard the clinical discussion piece of our presentation tonight, and now we'll talk about St. Mark's response to COVID-19. So of course, we've been together as a world fighting this global pandemic, and St. Mark's has been in the fight. And as such, recently, within the last, I'd say 6 months or so, we've had weekly collaborative conversations beyond, but they've been more frequent as of the last 6 months or so, and they've involved the 2021 class of trustees. They've involved the 2022 trustee and property stewards. They've involved our worship leadership, our audio visual leadership, and our administrative leaders. And we've been gathering weekly to check in, to monitor the community spread, to monitor our preparedness, to make adjustments. So when it's time for us to come together, we can do so effectively, fruitfully, safely, that we can do no harm and we can love one another as we love ourselves. So that has been our goal. And those persons that have been part of these conversations, they're listed here on the screens. Some have been engaged just about every week, and all have contributed something to this conversation. So we're grateful for all of these folks who have continued to be a part of the ongoing conversations, and we'll continue conversations, and I'll talk more about that momentarily. But one of the things that we've done several things, and we'll talk about the things that we've done as a collaborative. But one of the things that we've done under the leadership of our trustees, and Ricky left as our trustee chair, is we have installed an air purification system. You heard some in the last presentation about the distinction between purification systems and humidifiers. So we've got purification throughout the buildings, and Gary Boggs of Eris, and correct me if I pronounced that wrong, Eris Charlotte, he's the owner, has installed for us throughout our buildings, and he'll talk about that, these systems. So I invite Gary to come on. Ricky Left is on as well. He's been directly involved in that installation process. So we'll hear from those two. So Mr. Boggs, welcome.
Thank you. I'd like to thank everybody for having me here tonight. I really do appreciate it. And I'd like to apologize too. My laptop crashed right before this presentation. So I'm not going to have a lot of slides to share, but I do have a lot of information. First, my family owns a heating and air conditioning business that my grandfather founded years ago. When it comes to air filters in your home, do not go out and buy the really expensive Merc 12 filters because your heating and air conditioning system was not made for that. You will burn out your compressor. Get the mid-grade ones and then just change them more often. That the Merc 12 ones are the hospital grade filters are available for your house, but they're not good for your heating and air conditioning system. You'll burn it up. Just my 2 cents on that. Now, as far as the investments you guys have made, Active Pure is the main component of this. All of them have some type of filtration system in it, some type of filter media, HEPA filtration, charcoal filtration, low-grade ionization, but none of these products produce ozone, which ozone is great in the atmosphere, deadly inside of your facility. But the main component is Active Pure. And what Active Pure does is it takes water molecules out of the air, oxygen molecules out of the air, through a process of using ultraviolet light, turns these into highly effective hydroxyls. And what these hydroxyls do, they get put out of the machine constantly because these machines never get turned off. And these hydroxyls are basically like non-liquid hydrogen peroxide. Okay, so that non-liquid hydrogen peroxide, these particles land on the surfaces in your building, they float around in your air, and they actually deactivate mold, bacteria, viruses, by simply breaking down the cell wall. It is on a molecular level these things work. It's not magic. It's pure science. Viruses with this technology, extremely easy to kill. But this actually goes as far as this will kill black mold, okay? As far as completely eliminating its ability to reproduce and replicate inside of any environment. So this has been tested by independent laboratories, and it has been found to have a 99.97% efficacy rate at deactivating COVID-19 in under 3 minutes, okay? And COVID-19 is easy to kill with this technology. So imagine the stuff that's even harder. I mean, your influenza, your Pseudomonas, which is like your worst type of black mold. So even after this passes, and I hope it passes soon, this product is going to be great for your church environment because it's going to continue to help keep your church family healthy, and it's going to continue to help your daycare be healthy. I mean, I can give you an anecdotal story. I donated one to my kid's classroom when he was in kindergarten, with the understanding that this was well before COVID. He's in 3rd grade now. Up until last week, there has been no incidences of coronavirus infection in his classroom for the past 2 years. So last week, it kind of just it completely blew my great story about how effective this was in my kid's classroom. One kid, he might have gotten infected in the classroom. He probably didn't. But that's, I'm in talks with the school now to outfit them, and they're a K through 12 organization. So the different products you have in the daycare, you have the single room products. In the fellowship hall, you have the 2 Beyonds, which cover 2,000 cubic feet of air an hour, as do you have in the sanctuary. Really and truly, like I said, they all filter the air, they all move the air. So does anybody have any questions about how this works, or have I covered it?
I think you covered it well. Ricky Left may have something to add. I don't see any questions in the chat or in the Q&A, but if you do, church family, you have any questions about how we've responded in terms of air quality, please add those to the chat as Ricky comes on.
Yeah, the only thing I would add, Pastor, is that we've got them in all the classrooms. We've got them in all the major meeting spaces, the sanctuary, the fellowship hall. There's obviously, one in your office, one in the library, one in Brenda's office, Leah's office. So we really outfitted just pretty much the entire church. We've changed. We've got a new custodial staff that's doing a much better job overall in terms of cleaning the facility. We've tried to mandate during the course of the virus. Hank asked me just to explain to everybody what we've done. We tried to mandate that everybody would wear a mask, staff members, trustees, and any vendor / repair person that came into the building. I don't think there's very much more that I can tell you, but that's, Gary's product is great. If you see them, please don't turn them off. They are designed to run 24/7. And so we're really fortunate that the leadership team had the wisdom to go out and acquire, a pretty significant number of those. The other part of it is that they are warranted. And so Gary stands behind the product. He's going to come out once a year to change out filters for the systems that require the changing of filtration of the filters. So that's the only other thing I can add.
Okay.
I did notice a question where it said, how are these maintained? Yes, my company does offer a free annual service check on every product we sell. So we come out, to the church, to your home, whatever. We've got thousands of customers. We've been on South Boulevard since 1954. And we do these annual service checks every day. Next year, we'll come out to the church. We'll check every one of the machines. As far as expenses, the cost, the filters, the things in the classrooms, the filters just get vacuumed off. They don't get changed. The pastor's office, those just get vacuumed. The library, those just get vacuumed. In a couple of years, they get changed. The filters will need to be changed, but that's like 3-4 years down the road. Now the big units that are in the fellowship hall and the sanctuary, they're like a 6-inch thick HEPA filter with a carbon filter attached. Those get changed annually, and all of the active pure cells get changed every 2 years because that's the length of their effectiveness.
There was a question about the restrooms. We don't have anything in the restrooms, but as long as people will wear a mask, we do have. We have in most cases. I know Leah has maintained them in the bathrooms where the children and the teachers go. We have disinfectant spray that's available for you to spray in the restroom if you should happen to be in there. But if people are wearing masks, properly wearing masks that are effective masks, it should be a minimum potential for you to pick up COVID. But again, we have Lysol or Lysol equivalent sprays that are in the bathroom so that as you exit, you should probably spray for the next person to come in.
Yeah, and as I peruse your website, there's reference to connection to NASA and space units and the technology that's been developed for those units is the technology that's used in this system. Is that correct?
Yes, we are actually one of the few companies out there that has been inducted into the Space Hall of Fame for this technology. NASA ended up using it on the space station to get rid of basically ethylene gas that was coming off plant experiments. And after further study, they realized, wow, this is breaking down this ethylene gas at the molecular level. So it was our technology. They shared that with us. We took that technology, put it into research and development, and basically put it on steroids. And so, yeah, it kills a wide variety of pretty much every type of bacteria, germ, virus, mold, mildew. And like I said, we are one of the few companies. We're actually only one of 23 technologies invented in the entire world that has ever been inducted into the Space Hall of Fame for technologies. And I mean, we're very impressed with that. We're very proud of it. And we do kind of preach it from the rooftops. I've had several churches, doctor's office, dentist's office, once they do their homework on this technology, because there's a lot of other people out there saying that they can do what we do. And those people are getting sued right now, not by us, by the federal government, because there's, things like 0-point ionization, they don't work. It's it's very old technology. Putting a UV light inside of your ductwork, that works, but you're betting that that the germs and bacteria happen to pass through your ductwork before you get to it. This lays down a protective layer on your surfaces of these hydroxyls that if you touch it and you've got germs on your hand, it's going to kill it. If you've got germs floating around in your air, it's going to kill it. Like the reason we had to do individual units for the daycare, none of the rooms shared a circulation system. It's a boiler and a window units. But as far as the sanctuary and the fellowship hall, they have, unless I'm mistaken, they have heating and air conditioning systems that circulate the air throughout them. So they're going to be moving these particles throughout the rooms and throughout the hall, constantly. Because like I said, these things never get turned off. And if you're worried about how long they're going to last, the one in my living room has been running for 11 years. So, not making any promises there, 5-year warranty, but it has been running for 5 years or 11 years.
5? I thought you told me 7.5.
You know better. I got all that in writing.
Well, thank you so much, Mr. Boggs, and this has been helpful, and hopefully it communicates to our church family the measures that we're going to keep one another safe. So that's one of the things that we've done. Additional things that we've done, we've secured a temperature screening kiosk. We've Loretta House secured a grant, and we have, as you come into the fellowship hall, entering into the sanctuary, there's a kiosk similar to the one that's here on the screen, not that one, but similar to that one, that quickly tests your temperature, which is not a guarantee that you're well, or not a guarantee that you are not well, but it is a measure that the CDC did use early on, and we're using that kiosk. Also, we have some singing masks. So those who will be singing for the congregation when we do come together, they will be wearing masks while they sing, but you'll still be able to hear them well, and their voices won't be muffled because of the mask that they wear. Also, we have some disposable microphone covers that, as we switch microphone from person to person, we have these disposable covers that will protect those who use the microphones. We also have a registration system that you've been introduced to for our November service and for our December service that will ask some screening questions that will capture your information. So we'll know who's coming and who's going. That will help us with our flow. We'll continue to develop our registration system and our registration process as we get closer to coming back into the sanctuary for in-person worship. We've evaluated our seating capacity, and we've marked pews for our November and December services, and that process will continue for the foreseeable future. And then we also have a disinfecting atomizing sprayer, a handheld unit that we use for, while we do have the air purification system, if one person uses say the lectern or uses the speaker, we can disinfect the space before someone else comes in and use the space. So we've taken some measures. These are some measures that we've taken, and we're intentional about keeping you and us all together safe as we intend to come back in service. There's a question in the chat: when do you believe that we may get back into in-person service? So we'll address that in more detail. Thank you, Sister Elsa, for that question. If you'll hold, we'll come back to that, and I'll invite Sister Tiffany, Dr. Tiffany, to come in and share.
Amen, Pastor. Thank you. And Sister, your question is right on time. So at this point, we would like to.
Dr. Tiffany, her question is right on time too. Dingo asked before that about the masks that will be available. We have purchased masks. We do have an abundance of masks. So we will invite, or we will require those who are in the building to wear masks. And if you don't have a mask, we will have masks available for persons that come into the church facilities.
Amen. As Pastor has said, and as you have heard everything pretty much from Dr. Jacob, starting with how we started with this virus and what it did, not only to us individuals and to this world, but how our church had to respond to this. Worship has been one of the key places where we saw everyone having to figure out how would we gather together as congregations to serve and to be a part of a worship experience. So I just want to take you from where we started with the world shutting down, and when it was mandated that we could not be in person. We had some very strong leaders, and I know that they've even said, Pastor, don't thank us every time that you come on, but it really has been amazing that Trenton, Ryan Burkett, and Spencer Disher offered us, starting in March of 2020, virtual worship services when we did not have any other means. And not only have those virtual worship services been offered, but they have been done and they have grown so much in the quality and in the experience that we have truly been trying to bring the church into your homes. And so you see that we have been on not just one platform of Facebook Live, but via Zoom and YouTube. And we started in that. We continue to start in that. And as, again, the doctor said, as he was doing this, I could see how our church was responding to the ebbs and flows of the virus and what was happening and how we would offer worship service. And so in that summer, we did look like that we was getting some reprieve, and we offered some outdoor services. We were able to get outdoors a little bit. Several of our worship participants were able to get vaccinated. Our pastor and everyone, our leaders that we felt that had to be there could do so safely. Our trustees at that time did lots of work, as in bringing arborists in, making sure that the grounds were there. And we were planning to have another outdoor service, in fact. And then, as he said, the Delta variant spiked up. And we would have had a little bit more than the one, but we had to pivot a little bit due to what was going on then. And then we went to where we got to the point where around November or December, where we were able to offer at least one in-person limited capacity worship experience, where we wanted to make sure that we were able to see with some of the measures that we put in place, like marking of the pews, the social distancing, the temperature screens that Pastor had talked about, the air purifications being installed, all of those things taking place for us to be able to go in one time with a very limited number. We did that in November and December of 2021. And now we are at the point where we are looking at where could we do with a hybrid service and our readiness for that. So in our hybrid service readiness, we needed two things to happen, because as you know, within our church family, and we are grateful for that, we had about a split, almost a 50-50 split of worshipers in our congregation that still would like to have a virtual worship option. And as we're seeing, even with inclement weather, not just because of COVID, but the ability to still be able to have a virtual worship option because of sickness. And as we can see with the different variants now coming out, that we needed to always be able to provide a platform where our worship services were happening virtually, as well as happening as well as possibly could happen in person. In order to do that, as I mentioned at the very top, we have 3 volunteers that was, that was doing this and a little bit more. And of course, it morphed and it morphed and it morphed. We were going to need, and we must need, and we had to get more manpower, as well as updating some equipment in our church for us to be able to give our viewers at home, our worship participants at home, the same or close to the same experience as what was happening in person. And so that would require, as you can imagine, duplicate resources. So one of the things that our technology team was able to do was they found a service, and our church has now engaged with a company called Livestream and Live Control. And Live Control is now going to be able to handle the production in a professional quality streaming service. That's what will happen. So basically what happens is they're going to control what we call 2 cameras remotely and professionally capture what is happening inside of our congregation. And so by them doing that, that will free up our volunteers who have been doing this endlessly for us. We get an additional personnel, and we also got to upgrade our church's equipment. What did we upgrade? We got a new soundboard in our music and arts department where mixes will come in, sounding like recording mixes when it comes through your live stream, and you will get good audio in-house as well. We got 2 of those professional cameras that were installed this week. 2 questions that was installed this week, as well as that audio was connected to those cameras for those professional service on yesterday. Those 2 cameras gives 2 angles, and they're already up in our church. I was able to see them last night, and they look wonderful. So with that and the live control needs, we are now then at a point in our space of readiness of our next phase. And that means we are, as we have been, very much committed to making sure we can now offer a service both in person and remotely with all the things that it is required to do so, and to do so safely. So our next phase for worship and what that will look like is to go to a hybrid worship service, but the first one will be with essential worship participants first. Our target for that will actually be this first Sunday in February, barring that all those little things that I just named, I simplified those. If I know I'm not the people responsible, is a little bit more than what I just said goes well. Want to tell you why we are starting with the target of the first Sunday, which is a very good move and a very good push forward. We're almost there. One is, let me define first what we are calling essential worship participants. Essential worship participants are those who are leading a part of the service. The pastor, a small, very small ensemble, a liturgist or a person serving in that type of capacity that may be offering prayer or scripture in that capacity. And that's all. Those are who we're considering essential worship participants. Basically those in whom you may see on Sunday at this point, right? So that is how we're defining that group. Why are we starting off with just those participants after we've told you all of these things that are making us really ready? Well, one, as Dr. Jacobs said, we are still in a very high transmissive rate okay, with the virus. So we will always be a church that will lead with the protection of our church family first. And so therefore, with the spread going and the rate that it is, we, as Pastor said, those that are in these conversations feel that we need to still start with a limited amount of people inside the church at this time. The other reason for this is that we really want to ensure the readiness of the technology and all of the attention that we're going to have to give to the technology in the first pieces of all of this coming together to happen, that we want to make sure that we are actually using our resources to care for you and our parishioners when they come in, instead of worrying or having to give attention to maybe what is going on a tech end, to making sure that all of that is happening, as well as making sure that we have everything in place for our parishioners. Last but certainly not least, and this is where I'm hoping that I can get everybody on this call involved. We are going to need several volunteers and our church leaders and participants trained in the way that we can keep each other safe, and that the way that we will do this with St. Mark's. So as our worshipers come in, as others, how we're going to do that. Who will be the ones that are volunteering to do temperature checks and registration and some of the other processes that we have in place? Making sure that everyone has masks, and our church has already said that we will be providing surgical masks for anyone that comes. So we will need for everyone, especially you and leaders and those of you who feel safe enough to volunteer, to be able to understand the roles and what is required of you and how we lead our congregation back inside the house of worship. So therefore, we need time to make sure that we do that. It's not something that we want to rush. We really want to do it, and we really want to make sure that we have done it in a spirit of excellence and in order. Okay? So I want to give you a little bit about what the process will be for the essential worship participants that are coming in. We know, and I hope you are questioning, that we love our pastor. You know I love our minister of music. They are hired staff that whenever we say that we are coming in, that they don't have, they could, but they don't really have, neither one of them would say no to that. They're going to come and they're going to serve the congregation. So it is our job, congregation, to make sure that we keep them healthy and that we do everything that we can to make sure that we're not putting them in compromising positions. So for these people or persons that are essential worship participants that will be coming possibly the first Sunday in February, I want you to know the measures that they will be required to take in order to be able to participate on that Sunday. They will be given a rapid test at 9 a.m. that morning before entering. They have to show at the church, we will give them, they will take the test. They will have to have a negative result before they can come in, okay? They will also go through still the temperature checks. They will be socially distant. And they will be, and this is not, we're not saying, nothing that I'm saying means that this is going to happen for worship participants when we get there. This is for February. They will have to show proof of their vaccination status, and they will have to wear a mask that is conducive to their role. So as Pastor mentioned before, our music department has ordered special choir masks that vocalists we will wear the entire time, that will allow for us to breathe effectively, also covers everything that is there, and for our tonation to not be disrupted. I got that box today as well in the mail. So I got a lot of exciting things that happened within the past 2 days. And then every other person will be there, will be masked. We are starting with what I've called my in-person dream team that will also, for each one of us, still do those screenings. Right now, that's Miss Loretta Howes, Mr. James Howes, and Miss Veronica Adams. There will be no other ushers or greeters or anyone else that will be in the house of worship. Between those three, they will be handling our entering and exiting processes to very similar. That part will be very similar to how our worship participants, when they come in, will go. So with that being said, I'll pause a little bit. And Pastor, if there were any questions that came up, that's where we're looking. And then Pastor is going to go on a little further through next steps past our hybrid worship service.
Thank you. Yes, please continue to put your comments or questions in the chat. And I've got about just a few more minutes left. And then after my last few thoughts, then we'll address any additional questions. And I think we'll have the ability to bring everybody in case there are any live questions, or at least to greet one another and bid each other a good night. So thinking of, as I talked about, we've been having weekly collaborative conversations. Those will continue. We'll continue to have those. We'll continue in those conversations to monitor community spread. We want to make sure that we continue to watch to see the positivity rate, to see the hospitalization rate, to make sure that we are responsible as we have been, and we don't contribute to worsening the disease. So as we are hearing, as I am hearing, Omicron may be on the cusp of the edge of this wave, and maybe on we may be on to better days. So we'll continue to monitor that and ensure that that is the case. And if that is so, yay. I've said in many different circles, I'm so ready. I miss y'all. I love y'all. I look forward to seeing y'all, and I look forward to doing that in a safe way. So we look forward to that. We will continue to have conversation about what worship will look like. How many folks will we receive in the worship setting? How and if we will be able to use the fellowship hall as overflow, so that we may continue to keep everyone safe in our spaces. So as we do that, we will continue to talk about the number of worship services. If we need to go to multiple worship services, we will do that. We will do whatever we need to do to meet our congregation where we are spiritually and to keep our congregation safe. We'll also continue to establish the registration process that will work for us. It has worked well the past couple of times, and I'm grateful for Spencer, who's done the legwork on finding it and employing it for us. So we'll continue to wordsmith the questions that we ask, and how we capture the information, and how we receive folks when they come in who have registered and who have not registered. And then we will continue in those conversations to explore and establish those best practices for the St. Mark's way. We will establish our way, what works best for us. We will look at what some other churches are doing. Some of you have attended some other churches, and I'm grateful for your comments. Some of you have shared some things with me that other folks are doing. Thank you for sharing that. Please continue to share with me. You saw the list of folks who are part of these collaborative conversations. Feel free to share it with any of those folks, and we can all bring those and shape them to fit St. Mark's. So that's our hope and our goal, and we will look forward, and we will, as we're doing tonight, continue to communicate often, maybe over communicate, but keep everyone informed as to progress. So any other I think James Howes made a comment about wearing special design cloth mask over your N95 mask or your double surgical mask. So if you want to wear a mask that represents your school or your fraternity, your sorority, or your neighborhood or whatever, you can put that over the other mask that actually is designed for the purpose of filtering out the disease. And then Tiffany, you had a comment in here?
Oh, no, I think I was responding to
Oh,
someone.
okay. All right, good.
Mhm.
Great. And I did not see any other questions that came into the chat.
Wonderful. I will say that I did get one question, that an additional question that was for Dr. Jacobs about volunteering. And as Pastor mentioned, not only is this webinar being recorded so that those who were not able to join will be able to access this recording at any time, but we will follow back up and get those 2 questions answered that we had that Dr. Jacobs would not be able to get there. We do have a hand sanitizing station that is available. Again, thanks to that dream team that I talked about. They have come up with a very nice little process, Ms. Howes, Mr. Howes, and Ms. Veronica Adams, where they have a hand sanitizing station when you walk in, how the mask, and just sort of right now how the flow happens of when you come in. There will be also other things, again, like within worship, how we still do things will still be very contactless, for lack of a better word. And those, so like contactless offerings and things such as that, and how we seat people, all of that has been very much discussed and vetted and tried. And so we are ready in that standpoint. As Pastor said, we will continue to provide you with hopefully things that you will see us inching closer and closer to. I would tell you, church family, again, this is a beautiful day, and I'm just joyous to be able to share that we are in this next phase, and we are in it, as you have heard, where we're entering in it very safely. So, I'll tell those choir members, Fernando is, and myself, anxiously awaiting when we can get a little bit more than larger groups, get choirs back. But we will continuing. We are getting closer and closer to that. So, God willing, we will continue to see great progress. And so from tonight, we do hope that you have been able to see those progressive measures happening.
All right. So I'm grateful for that collaborative team. I'm grateful for the vision for this. One of our team members, actually our chair of our administrative board, posed the question and was instrumental in bringing everything together. So Hank Dozier, thank you for the dream. Thank you for the work behind the scenes and bringing us together tonight. Thank you for everyone who's been part of the collaboration and conversation. Thank you to Dr. Jacobs, to Mr. Boggs, to Fernando, to Tiffany, to Brother Left, for all who participated in the conversation tonight. Thank you at my church family. Again, I miss you and love you, and I feel good about where we are and feel good that how long, not long, but we do need to continue to exercise a little bit more grace and a little bit more patience as we look forward to coming in together safely and in love. So with that, I don't know if I don't see any other questions. So with that, we had 7:30. We're a minute over. Thank you for your grace on the minute over. I'll invite Dr. Little to lead us forward in prayer.
Amen. Dear Heavenly Father, we just want to thank you for this day, God. And we just want to thank you for your grace and for your mercy, God. We want to thank you, God, because if we reflect on how good you've been to us, how you've kept our church family, how you blessed us, God. When we didn't see a way, God, you made ways, you provided, God. And I just want to thank you for everyone on this call, Lord, that has heard, has been diligent, Lord, has had a willing heart, Lord, to want to engage, to serve, to lead, to be responsible, God. And most of all, God, we praise your name for every worshiper in this building, in this house tonight. Lord, as we leave this place, continue to guide us, continue to give us creativity, continue to give us capacity, continue to give us discernment, God. Lord, let your will be done in our lives so that the light of Christ will show forth to those who don't know you. And God, as we continue to spread this gospel in multiple forms, God, we want to make sure that everything we're doing points back to you, Christ, points back to the one who can save us, who forgave us, God, and who will be with us through it all. So whether we're praising you on YouTube and our Facebook viewers and our live worshiper viewers and our Zoom viewers, God, we thank you. And we will continue to have a heart of worship. We ask you to continue to heal this land. And although this is a hard devil to fight, he is not harder, nor is he more powerful than you. So we continue to ask God's healing, blessing, and coverage as we go forth on this day and in the days to come. It is this in the mighty name of Jesus we pray. And the people of God said, amen.
Amen.
Yeah, good night, everyone.
Every time
All right, y'all.
Wonderful, man.
All right, good job, Dream
Good.
Team.
Good job, everybody.
All right.
All
Thank you.
right.
Wonderful job. All right.
Hey, First Lady.
Every time she turn around, y'all did that.
There you go.
First Lady, y'all had Fernando happy last night. I played, and